No medicine can remove the cause of a lifestyle disease, but you can. Welcome to this before and after series on health, where we look at different treatments for various lifestyle diseases. This time we are handling heart disease, and it is been divided into 5 different sections. The first section is on what are the causes and what are the ways of early diagnosis of heart disease. The second is on the latest available treatments at present. The third is on the comorbidities that usually come along with heart disease and which any heart disease patient should be aware of. And the fourth is the importance of lifestyle correction in treating heart disease. The fifth and final one is on examples of various patients who have undergone lifestyle correction under clinically supported conditions and what are the experiences that the doctor has in these cases. Welcome, Dr. Jolly. Dr. Jolly Thomson has extensive experience in treating lifestyle diseases, and her focus is on minimizing the need for surgery and medicine. The first question to Dr. Jolly is, apart from the causes, for a patient or for a general well-wisher, what are the various ways in which they can understand that there is something wrong with their heart?
Nowadays, it is very common that many even very young people are just falling down and dying. And many of the things, it may not be heart attack alone or heart attack, stroke, and many things can bring sudden death. But especially after the COVID, the sudden death because due to coronary artery disease, that the cardiac arrest and cardiac problem is actually increasing. So many will be thinking that when they're talking, there was no problem, no health issue, but suddenly collapsed and died, or suddenly collapsed and taken to the hospital. Angiography or angioplasty is done and needed a bypass. Even bypass surgery is very common, even in 30s and 40s also nowadays. So it is very important from the cardiac point of view. The most important thing is to diagnose it early, not when you are falling down. You have to, the golden time is before getting a heart attack. So the early diagnosis, there are so many methods in the diagnostic sector. There are so many methods are there, so many tests are there to find out the heart health. And most importantly, we should understand that the heart health is not standing alone. Heart test is a manifestation of the whole system or the whole body. If you have diabetes or hypertension, that itself shows that your cardiac health, heart health will be damaged. So that is, we have to give importance for the early diagnosis as such.
Actually, when you mentioned about the issue of having diabetes or hypertension, that creates the ground for heart problems. Similarly, we hear that obesity, even autoimmune diseases like arthritis, and all those sort of diseases that are now quite common, they also contribute to heart disease. So, can you explain to the viewers what exactly is it that patients who are having these diseases, what is it that they should know regarding their heart?
Basically, when usually all the talks about the heart disease and how to prevent it or the predisposing factors, we all talk about the smoking and alcohol. That is all is very important. So I'm not talking about that aspect because everyone knows that if you are a smoker, the heart risk is increased, and also if you are taking alcohol, even the usually most of the attacks comes especially in night, and there is a possibility that if you have taken a few pecks and then going for sleep, there is a risk of cardiac arrest or the heart attack and all. So the other things which we are usually not talking is, the first thing is obesity and the metabolic syndrome. Obesity, the metabolic syndrome means your metabolism, your chemical activity of your body is in an irregular manner. So that will definitely, heart also part of the, actually heart is giving all the nutrients, and it is pumping and the blood is flowing because of the heart's working as a pump. So if there is a metabolic problem, the chemical reaction, there is a change, it will be most importantly reflected on the blood vessels. The blood vessels get damaged. So when we consider the predisposing factors, diseases, diabetes, hypertension, cholesterol or dyslipidemia, even arthritis, everywhere there is a metabolic error is happening. So if the pressure is increasing, hypertension, that means the heart workload of the heart is increasing, and the blood vessels capacity to dilate and dilate mainly dilate is under compromise because of this calcium buildup, or this blood vessel walls become rigid actually. So if the pressure is increasing, either the blood vessels is getting rigid and the dilating capacity is reduced, that we generally call it atherosclerosis. And one type of atherosclerosis is called atherosclerosis, that is the plaque formation. And for that, we are putting the stent and the bypass, etc. is done for that block to relieve that. So, but usually we are only treating actually, but we are not trying to prevent the disease for a more in a more conscious way. We are not trying to prevent. So, if you have diabetes and hypertension or dyslipidemia or excess cholesterol or triglyceride, you should understand that you are prone for a heart disease, and we have to correct that, not to take medication for that. It's all lifestyle disease. Actually, these sort of lifestyle diseases are becoming the real causative factor for. The same is applicable for the arthritis and autoimmune disease, etc. This rheumatoid arthritis, it is actually affecting, we are feeling the pain on the joints, but it is affecting the blood vessels also, because joint is the same material, that is collagen, is used for the building of the blood vessels also. Collagen and elastin, actually that they are actually making the blood vessel flexible and dilatable and all. So if the collagen and the elastin, that is the protein which is mainly used for this blood vessel wall, it is getting damaged. Just like the collagen on the joint, it is getting damaged, but those places you feel the pain. The pain is pain receptors are very much present in the joint, so you feel the pain. But there is no pain receptors in the blood vessels, so you don't feel the pain. So that is the only difference. If you are having somewhere pain, that means the inflammation is generally it is affecting the blood vessels also. If you get a cut on the blood vessels, so you may not feel the pain. Only that you will feel the pain on the skin or the joints. But the blood vessel as such doesn't have any much of this pain sensation, so we ignore it. So we understand that if there is arthritis, there is the blood vessels also getting damaged.
Actually, when we are talking about diagnosis for a normal person, he would always prefer some blood tests or an ECG and all that, rather than an invasive test like angiogram and all that. So, what exactly is possible, to know about the heart condition from this blood test and this ECG?
Early diagnosis point of view, to prevent the heart disease, it is blood work and your body composition. Nowadays, there's facility to assess what is the composition of your body, how much muscle it is. Most importantly, the muscle mass and lean mass ratio. See, ideally, gents should have around 10 to 15% of fat mass, and the rest should be only 15%, 10 to 15% should be fat. And for the ladies, it can be slightly higher, 15 to 25%. So, if you are able to keep that, whether that you are able to keeping it up like that, that is the most important. When they say in Indians, especially there, we are more of the if the same BMI, and when we are compared to the model, if you are taking Caucasians and the Indian or the South Asians, generally we have more fat in our body, and inside the fat itself, the brown fat, there are two types of fat. One brown fat which is thermogenic, or it can be easily converted into energy or in the form of heat, that will be higher in the Caucasian group. And in Indians and the other South Asians and Africans, it will be low. So the other type of fat will be predominant. So almost 30% difference can be there. So that is the reason why we get this Asians get, especially when working in the part of India, basically in the South India. So we get almost 10 or 15 years earlier when you are comparing the heart attack age and things like the age comparison and all. We get the heart attack at an early age, even 10 or 15 years early. That is happening actually in other diseases also, like cancer, breast cancer. Those things also is getting in the early stage. That is because of mainly one of the reasons is fat distribution. Actually, many people, we are in the medical field also not talking much here. Is one aspect is the control of the immune system. We call all these diseases as a inflammatory disease. The immune system has two wings, inflammation and anti-inflammation, that is preventing the inflammation. This is actually controlled by the two fat. One is omega-3 and one is omega-6. Everyone knows that omega-3, the fish oil and all, is good for heart. But we don't know, not much of talk is there about the other omega-6. So omega-3 is reducing or the omega-6 is increasing is equally bad for the inflammation point or immunity point of view. Omega-3 is anti-inflammatory and healing part, and omega-6 is inflammatory. That is also, it's needed and it is good, and it is actually from your as a defense point of view to prevent infection and all, it is good. But inflammation, over-inflammation, too much of inflammation is the reason for almost all the lifestyle diseases. And even in the infection also, we know that COVID time, the inflammation, too much inflammation is the problem, and we are trying to block that inflammatory process with this steroids and all. So all the medications actually we are using in the modern medicine is somewhere in this pathway, that is the inflammation and anti-inflammation, that is omega-3 and omega-6 pathway. It is actually blocking the inflammatory pathway, actually. That is actually giving you symptomatic relief. That is applicable for the heart disease also. We all know that the coronary artery disease, we check for the calcium score, the scan is there. And in that, actually, inflammation, that is over-inflammation, and with the calcification, that is actually making the coronary arteries very rigid. And that is why that if the calcium score is very high, you won't be able to put a stent. Then such patients, they have to go for the cardiology. Interventional cardiology will not have much role. Then the bypass surgery has to be done. So all this cardiac problem also is connected to the inflammation that everyone should know.
Actually, you just mentioned that South Asians have a different body composition, which creates conditions for earlier onset of heart disease. It is also heard that that South Asians generally age around 10 years earlier than Westerners with respect to metabolic diseases. What is it that we in South India, for instance in Kerala, what is it that makes us in Kerala age metabolically faster than Westerners? Though we normally notice that the skin texture of Westerners gets aged faster than South Indians generally. So what is it that is causing this problem in South India and or in India itself?
Basically, Indians have a very good advantage because our skin has a much more resistant to sun. This skin wrinkling and all is because of the sun's effect, that is ultraviolet rays effect and all is there. So we have a better skin health because we have a moderate amount of melanin, so that will prevent. And if too much of darkness, like in African countries, that also prevent that will prevent that ultraviolet rays, but it will prevent the penetration of the good part of the sunrise also. So we have a moderate coloring, and so it will be good for the point of view of the skin coloring. But our problem is maybe because of the earlier life, this genetic and the development in our genetics and all. We have always have the tendency of excess fat accumulation. That itself is not the brown fat. It is the storage fat. The white fat will be, or the yellow fat will be more in our body. And that is actually that fat, whether it will lead you to disease, is depend on what is the composition of the fat. That is, if the omega-6 that is inflammatory, if it is high, if you are eating this vegetables, to me that your fat and your excess fat in the body, excess tummy, is because of you are eating too much of nuts and oil seeds or too much of vegetable oil. Generally, almost all the vegetable oil except the coconut oil and palm oil. Palm oil is also only 10%, comparatively very low in omega-6. Coconut oil doesn't have much of the omega-3 or omega-6. It's only saturated fat. So it is inert. But if you're eating this cashew nut, badam, pista, all sort of these nuts and the oil seeds like any oil seeds actually, others like peanuts, it all having high amount of the omega-6 fat. So if the omega-6 is accumulated in your body, the inflammation will flare up. That is the basic thing. But we can find out what is the inflammatory level of the body. So in the heart patients, due of the inflammation of the blood vessels, we can assess. Nowadays there are so many tests are available. The cardiac markers and inflammatory markers, these all come higher in very early stage itself. Even the blood sugar, even the diabetes, you should understand that this is the type 2 diabetes which is creating problem. There is insulin resistance. Insulin quantity is high. Actually, this hyperinsulinemia is promoting the deposition of the fat inside the blood vessels and blocking it. So, but unfortunately, what we are treating actually for the diabetes itself, we are actually, this type 2 diabetes also, we are in the injection, giving even putting insulin pumps on if you are affordable. So it is scientifically it is wrong. It is actually, if you even for the type 2 diabetes patients, if you are taking medicines to increase the insulin secretion or injecting insulin, is actually damaging you. You are only looking into the diabetes and the glucose count. Glucose may reduce, but the insulin level is increasing. I have seen patients who are having even last day itself. The patient is not diabetic, and he's having all sort of problems. Is there very tired, and he's having obesity is there, tiredness is there, fatty liver is there. His HbA1c also only 5.4, but his insulin level is 300 and something. So hyperinsulin, any hormone, just deficiency of the hormone definitely is a matter. In type 1 diabetes, there is a deficiency of the insulin and you have to take insulin injection. But in type 2 diabetes, there is no deficiency and many of the people, the hyperinsulinemia is there. In that case, we have to correct this metabolic error. Instead of giving injection to raise give insulin and making the, when you are taking, increasing the insulin level, you are encouraging the body to, in the opposite way, to deposit it inside your body. If you are not taking, if it is excess in sugar, you are not, you are taking carbohydrate, and if you are not taking insulin or the anti-diabetic medicine, it will be excreted in the urine. Instead of that, you eat all the carbohydrate and take insulin, and it is allowing it to get deposited in your body. Whether when your adipose tissue is full of fat, it will be diverted into the, it doesn't have any place to deposit. So it will be circulating in the blood, and that is shown as the increased triglyceride. Actually, the triglyceride, that is the fat part of the in the blood, that is increasing, and there is no place to deposit, and then will be to get deposited in the blood vessel itself.
From what you said, it is like, the insulinemia, hyperinsulinemia, that is high insulin, which is quite common in diabetes patients who are under treatment with insulin injections or with medications to increase insulin output by their pancreas. They are actually under more risk of cardiovascular disease, and that insulin itself, high insulin itself, is one of the major causes of it. So next, we would like to know that regarding tests, the other interventional tests and all, like angiogram and the others associated with angiogram, regarding those tests, that is angiogram primarily to start with, when is that advised, and what should patients know regarding if they are advised an angiogram test? What is it that the doctor is trying to figure out?
Angiogram is usually advised. The patient is saying that I'm doubtful about, doctor, I want to check I want a general checkup, and I'm feeling some dizzy when I'm walking fast, or when climbing stairs, I'm feeling discomfort in my chest. Or as a part of the general checkup, doing a TMT test, a treadmill test, then some ECG changes, or the patient is not able to tolerate. In such cases, usually doctors advise for an angiogram in a prophylactic way to find out what is the reason. The other thing is, angiogram is usually done when you're going to the hospital and having a discomfort. Usually, doctors will do an ECG test. If it is there is no ECG problem, that means it can be an angina. That's a coronary artery may be having block, but there is no attack. If the ECG having elevated ST segment elevation, which is called a STEMI, actually, usually, if the patient is having a doubt about the heart attack, and if your ECG is checking, and if it is increased, they will be taken as a STEMI, or attack is already happened. And the other test, that is ECG, will be if you are in pain and immediate attack suspicion is there, it will be done an ECG first, and then if it is increased, then the next test in immediate this thing also, the troponin test. The troponin is one of the cardiac protein, cardiac muscle. It will be oozing out. If you have an attack, that means attack means some of the heart blood vessels are blocked. If it is severe, it's a major heart blood vessel is blocked, you may have severe pain and you may collapse and go into a cardiac arrest and the patient may die. But if it's a small blood vessel, it is blocked, you may not be knowing that, maybe some slight discomfort and you may be ignoring. That is called a silent attack. But if you're having little more and you have, even with a small discomfort, if you're going to the hospital and doing ECG and doing the troponin test, the troponin will be increased within 1 or 2 to 4 hours. It will start increasing if you really have an attack. And the next test which you are usually the doctors will advise, the most less invasive, is the echocardiography and Doppler study. So echocardiography also we'll be able to know the major attack is there, or even a moderate attack. There will be the muscle wall will be not be functioning. The heart will be beating. No, so some part of the muscle may not be eating, and the doctors will be able to find it out from the scan itself. That is ultra Doppler study and of the heart. And also, the next test is to know, not an invasive test without doing, because this angiography, the regular angiography is called PCA, that is percutaneous coronary intervention. That is it's a risky procedure actually. You'll be usually from the wrist to that the radial artery, and inside that through that the doctor will be introducing a catheter into the blood vessels and reaching the aorta and the base of the aorta, that is the base of the aorta, there is two coronary arteries are going. And in the coronary arteries, right and left is there, each coronary artery entering and injecting a dye and finding and getting the images and finding out. There is so much of problem, because if you have atherosclerosis, and there will be, this atherosclerosis can be taken as small, the skin, you can have pimples, no? Just like there can be pimples that, or small swellings or small bulges of the fat. And if you are going on the way with this catheter, it can poke off some other places, and it can get that fat, accumulated fat can come out. Just like a pimple bursting, we'll see that there is some white liquid and fatty things are coming out. No, just like it can come. If it is coming out just like that, it will, that blood clot can form. If anything foreign or something is oozing out from the blood vessel, there blood clot, the platelets and the RBCs and clot there, and you will get a clot. So that is also risky thing. So there is a risk is there in this all the invasive procedures. So the most safest way is to early diagnosis point of view, do a blood test. In the blood test itself is now troponin, high sensitivity troponin is there. That is an the cardiac damage showing, you will be able to assess. And also HSCRP, that is it's an inflammatory marker, especially for the blood vessels. And in homocysteine, that is also actually, if the homocysteine is high, that is also causing erosion of the blood vessels. And also definitely the cholesterol and triglyceride. More than the cholesterol, the triglyceride and the HDL. If the triglyceride level is high and HDL is low, that means there is so much of fat inside your body and inside your blood, and that will be definitely the chance of getting accumulated in the blood vessel as atherosclerosis and the plaque rupture and all will be high. So if this test with, if any of this is high, and even the just weight measurement itself, actually ideally if you have 175 centimeters and you're having a weighing machine, if you are very fit and very muscular, you can have 175 centimeters, mean you can have 75 kg. But if you are a moderately active, only you are doing and the computer and just less than half an hour exercise a day, then you should keep your weight in around 65. That is the ideal. Otherwise, if you're more weight means more fat, less exercise and more weight means more fat. The fat content is increasing and your chance of getting heart disease will be higher.
Actually, when we are talking about this angiogram, there is this talk about CT angiogram and MR angiogram, then this calcium score, and so on. So, what exactly should anyone understand when when this talk is about getting such tests?
First, I explained what is the calcium score test. Calcium score is basically a CT scan, and we are measuring the calcification. In the difference between the calcium score and the CT angiogram is, in the CT angiogram, you will be injecting a dye into the blood vessel and taking a contrast medium is needed. So in the calcium score, only the calcification, there is no dye is injected. The calcification of the blood vessel can see. So that if there in the CT, there's a calcium score, there is no calcification, doesn't mean that atherosclerosis is not there. Atherosclerosis and these pimples or this fat bulges in the blood vessels will not be able to detect. Only if it is calcified, you will be able to find out that. Actually, this not the usually the the problem this acute attack and all is not because of the calcified blocks. It is actually the non-calcified blocks. That is, this calcified blocks are, that is also a problem, that is reducing the blood circulation and all. But they are not producing this rupture of the plaque and getting clot and blocking, total immediate blocking and acute MI, the chance will be less in that sort of problem. So if you want to know what is the condition of the blood vessel, which is not this calcification is not without the calcification, you have to do a CT angiogram. And for the CT angiogram, you have to do the give the contrast. Most of these cardiac patients, they will be hypertensive for a long time and also diabetic and dyslipidemia. This will be having renal problem. If the kidney is already compromised, the GFR or the creatinine is more than 1 or the GFR is more than less than 90, then your damage, this test itself can damage your kidney and you may go into renal failure, or at least your renal function will be reduced. That is a usual thing. After an angiogram, if the kidney is compromised, after the angiogram, the creatinine level will be increased. Even today, I had a patient who was coming, cardiac problem. He has severe, he had an angiogram itself, and they tried angioplasty, and because of the calcification, he cannot do it. They will not be able to. He is advised to do a repeat angiogram, angioplasty, try for angioplasty after a few months, and then if not possible, then go for a bypass. And this patient, actually previously his creatinine level was only around 1 and all. Now it is 1.8. Actually, just one this test, that is contrast injection and this angioplasty, for the trial of the angioplasty and angiogram, they injected to the contrast and it is reduced his renal function. Now they are waiting for the renal function to improve and then go for another angioplasty again with the injection. So it will definitely it can bring down his GFR. Now itself it is only 50 GFR. If another angioplasty and the trying for an angiogram, it may it depends on each patient, and it will GFR will come down and creatinine go up. Most of these patients, this patient also is a diabetic and hypertensive and so many medications on them. So that we have to understand. The risk associated with the testing also. The blood test, you can do any amount of test, only a prick is needed. But ultrasonography, that is also is okay. Now, another test I forgot to mention earlier is the CAMT test. So that you are to get a idea about what is the atherosclerosis level. The heart blood vessels are so deep inside. So the superficial vessels like carotid artery, which is the main artery supplying the brain, which can be easily assessed with the ultrasound Doppler study, and also this ultrasound we can measure the thickness. Actually, I usually advise as a routine part of the cardiac, all the cardiac patients, we ask for a coronary artery Doppler and this coronary intima media thickness, that is CIMT. And with that, even we can assess the vascular age of the patient. Even the patient may be only in the 40s, but the patient vascular age may be in 60s or 70s. So that atherosclerosis, the fat deposition is there. There's an easy way of assessing. And also those patients with this peripheral artery disease, these heart patients, it's not only the coronary artery is affected, it is a peripheral artery also may be affected. In that case also we can do a peripheral artery Doppler study also, and we can see that when you are doing the lifestyle changes, you can see after 3 months we can repeat a test again, because it is not having any complication or any side effect, and we can see the opening of the blood vessels. Only thing we cannot do it directly on the heart, because if you are doing it directly on the heart, it will become either an invasive procedure with ultrasound that is also available nowadays. This ultrasound probe is introducing into the blood vessel, and there also the invasiveness and the risk is there. And this dye injection, there is risk is there. But in the ultrasound, the external ultrasound, you can assess, and you don't have to directly measure it on the coronary artery. You can do it in the peripheral artery, and we can see the advantages. You can see the assess the result of the treatment also. If you are doing the lifestyle correction and you are whether the paying of your efforts, that is also it's very important to assess.
Okay, and with that, we come to the end of the first part where we focused on what are the different ways we diagnose heart disease. And in the next segment, we look at what are the latest treatments available for heart disease, cardiovascular disease. Thank you. The informed patient is key to treatment success.